All right, welcome everybody to Health Talk. I'm Peter Christian. That is the aforementioned John King over there. By the way, happy birthday yesterday.
Yeah, thank you very much. I am now 35. Still alive.
I'm supposed to be impressed by that?
I was... I'm a bit overshadowed by Peter.
Yeah, just a bit.
He's lapped the calendar a few times, and I don't think I'm ever going to catch up.
Let's put it this way. I'm happy to slow down and wait for all of you. Okay, I'll be happy to do that. So you could add your ages together and you'd still be behind me. But anyway, we have Ryan Duarte here in the studio. And Ryan, first of all, welcome. Thanks for coming to the show.
Thanks for having me. I really appreciate it.
So now you're not a doctor.
Nope.
But you are working within what's going on there at Community Medical Center.
I'm a software developer, and I'm working with Community Medical to help reduce skin cancer in our community. And
Okay.
My kids were born right here. I'm a Bitterrooter, and my kids were born at Community. And so I had this passion on my heart to figure out a way to reduce skin cancer so my kids wouldn't get any more sunburns, and no one else's kids would ever get sunburns again.
Cool.
And so I made up this app, and it's called SolarScreen, and it can be found at SolarScreen.com or on the App Store or for Android in the Google Play Store. And the idea is that it gives you a little reminder when the intensity of the sun has gotten to the danger zone. So you set this danger zone depending on your own skin, and when it hits that level on a scale from 1 to 11, maybe you set it at 6. And when it gets to 6, it just gives you a little reminder, and you change behavior at that point. You know, put on some sunscreen, put on a long sleeve shirt, go out of the sun, whatever it takes. But mostly you need to take care of those kiddos, because when it gets to 7, intensity of 1 to 11, those kiddos you need to just stop what you're doing and put on the sunscreen onto the kids right then.
Years ago, when I was young, and it really was a long time ago.
Well, the Earth was much closer to the sun at this time.
when I wasn't being chased by the dinosaurs. But anyway, I would lay out in the sun, right, as a teenager, because I wanted to have a tan, because having a tan was cool, and I would promptly fall asleep, right? And that happens a lot. You wake up and all of a sudden you're a lobster, right? So now, is it more dangerous now than it was, say, back in the 60s and 70s? Because of the depleted ozone or whatever, or is it the same as it was back then?
So it is a little bit more dangerous, but this year isn't the record high.
Okay.
The record high was back in the 80s, and what happens is when it does get past 11, which on a scale from 1 to 11, it's really, really dangerous, and people need that information right away. Also, when people fall asleep in the sun, that's super dangerous too. So what we do is when you apply your sunscreen, you push the button on SolarScreen, the app, and it asks you, in how long should we remind you to reapply that sunscreen?
Did it just go off?
No, it didn't. But
Wow! Oh my gosh!
Thank you, son, for working with TalkBack. We knew we were impressive.
This was a text I got on my phone that has nothing to do with that, but how fortuitous. What a coinky-dink. But
maybe you read that sunscreen and you see that it says, reapply in 90 minutes. And so when you apply your sunscreen, you let the app know, remind me in 90 minutes, and that way you never forget. And you don't forget to apply it on your kids, because they really don't have a reminder other than SolarScreen.
So can you set the timer for different individuals on the app? Because I got 3 kids. I'm going to have 3 cell phones if it can't do it different times.
Sure. What I would say is put the sunscreen on your 3 kids at the same time.
Okay. Gotcha. That's
what I've been doing with my 2 kids, is sunscreening them up, and my wife and myself, we do it at the same time. And we've been getting like the SPF 30 or 50, and that's what I would recommend. And then we apply it, and then we reapply when it's time. Only if it's necessary, only if the intensity of the sun warrants reapplication.
Now, how does the phone know the intensity of the sun?
Okay, so what we do is we work off the GPS location of the person. So at this GPS location right now, the EPA, the Environmental Protection Agency, says that the intensity of the sun right now is 2. And on a scale from 1 to 11, it's real low right now, but it will be climbing throughout the day.
Why did they use the Spinal Tap level of measurement to 11? I don't understand.
It's just common across the board. Everybody understands 1 to 11, and it's gotten up to 28 before actually.
Wow.
At very high.
Oh, it can go up to 28.
It can go much.
So it
higher
can go
than
up
that.
past 11.
It can go quite a bit past 11, but anything in the past 8, you really need to change behavior immediately, and that's what this app is going to be good for.
Okay, here's what I want to know. I want to know how you, being a total ignoramus with computers, as John can freely, just corroborate, how did you come up with all the stuff, how you make it happen so that the app tells you what to do? I mean, there's obviously some science involved in that because you're obviously a computer, engineer. So give me the steps that you took to make that without revealing anything, proprietary, but...
When I first had this idea of reducing skin cancer, I wasn't exactly sure on what the best way to do that was.
The platform, right?
Yeah, so I actually went into the Blackstone at the university, and they helped me find my co-founders, which are a computer science master's student and a PhD, Evan Ozer and Brad Balls and Rob Smith.
Cool.
And they're all computer science masters.
Geeks.
We really...
They prefer the term master.
Sorry.
Sorry.
We really racked our brain. We spent about 1.5 years, and we developed a system that is like an artificial intelligence for skin cancer prevention. And we're not saying we can prevent skin cancer because we can't. But what we can do is help people to not get sunburned, which is the first step in preventing skin cancer, and helping people to know when to apply sunscreen on their kids, which is going to help over the lifetime of the child.
I have to know, why, of all the problems in the world, why was this one that you picked out?
Sure. So my dad got skin cancer on his face. I had to watch it get burned off. They put this cream on it. And if you don't have skin cancer, no big deal, just cream. But if you do, it's going to turn all the skin cancer on your face black and then start burning it off by turning it red and really burning the skin. And so he put it on, and then my mom and my father-in-law, my mother-in-law, and we found out other people in our extended family have all been coming up with skin cancer one after another, and we've been having to watch it. And it's very, very painful. If there's anything they could do to go back in time and erase some of those skin damage points, those real bad sunburns when they were 7 years old or 11 years old. And in our family, it was just common for maybe 4 summers a year, 4 times a summer, we would get a sunburn. And I thought this was normal. And now I found out it's not normal at all. No kid should have a sunburn ever. And now their parents will get a reminder to help them. And from now on, if you have SolarScreen, your kids shouldn't be having sunburns.
Yeah, we're going to come right back. By the way, if you have a question or a comment for Ryan Duarte, he's an inventor right here. An inventor, like a Thomas Edison, is right here. So.
Master.
Yeah, I'm sorry.
Computer master.
That's right. We'll be right back, and we'd love to hear from you if you have a question or comment, especially if you have kids. 721-1290 is our number. We'll be right back. Little sunshine music for you. Just Ryan Duarte here in the studio. Little Here Comes the Sun from the Beatles, because there it is. It's out there right now. So Ryan, let's get to the phones, because we always like to put our callers first. So, Mark, you are on with Ryan Duarte. Hi.
Hello.
Hi.
Hey, Ryan, I got a question from you.
Hi, Mark.
For you, not from you.
Okay, what's up?
I've been coaching Little League for 12 years plus, and I have a problem with kids, bringing any jewelry or cell phones, have them leave it there on the bench. But then I also have another small problem. I hardly get any parents, to help assist coaching. We're out there 45 minutes before the game, and game can take up to like an hour and a half. So how will this application work when we can't get it? Parents to help with the fielding and batting.
So you're asking how can the kids know when it's time to start covering up if they don't have their cell phones with them?
We can't pay anyone to Hey, Bobby, it's time to, put on your sunscreen.
Right. It's the bottom of the 7th inning. Wait, hold on. Stop. We got to put on the sunscreen, right?
So he's doctoring the ball.
Yeah. Okay, well, we'll go ahead and ask him. What do you think, Ryan?
So, Mark, what I would encourage you to do is put sunscreen on all those kiddos if the intensity of the sun warrants such behavior before the game. And then about 90 minutes later, that's usually how long SPF 30 or SPF 50 lasts, about 90 minutes. So maybe 90 minutes later after you've applied the sunscreen, you do a team reapplication. That's what I would encourage you to do, and just get them all. But if the intensity of the sun doesn't warrant this behavior, like maybe the intensity of the sun is a 3 on a scale from 1 to 11, you could take the time to decide whether or not you're going to reapply based on the intensity of the sun is what I'm trying to get across.
Okay, so can we just look outside and see that it's a hot day or a bright day and know the intensity of the sun?
Yeah, that's an interesting point. You can't. Actually, the other day it was cloudy, overcast, about 55, 60 degrees, and it was a 10 on a scale from 1 to 11.
Wow.
Yeah, and we've had 8s and 9s regularly on very cloudy, cold, overcast days. And when it's real hot, sometimes like, for instance, right now, it's a 2. And it's a very hot, very sunny day. And people woke up this morning and thought, I need to put on my sunscreen. But realistically, they need to put on their sunscreen when it maybe hits a 4 or 5.
Okay, now one thing was somebody from I have a skin condition called psoriasis, so I've done a lot of studying about this. There's UVA, which is very beneficial, and UVB, which can be damaging. Okay, yeah. So what rays are you measuring? Are you measuring a combination of the two, or just B or A or what?
Yeah, a combination of the two, but you're right. UVB is what we care about, and the intensity is given to us from the EPA, the Environmental Protection Agency. They're seeing at this location, with this cloud cover, with the angle of the sun at such a degree, it's called atmospheric distortion, and they figure out exactly at this time of day what the intensity is on me right here, and then I can make informed decisions. And it makes all the difference on whether or not me and my kids and you and your kids are going to get sunburned at all this year.
It's a valuable resource. I mean, they send one hapless EPA agent to the sun to measure this every day. They never come back.
What's my assignment today, boss? No, but seriously, is there any way for this app to, aside from making a noise, or a beep, or what? Does it have the standard beep, or can you make your own little siren or wail or scream?
Can it play the danger zone?
I mean, seriously, is that something you can design in there?
Well,
or
you guys
is it...
are probably familiar with push alerts, and so on an iOS phone, like an Apple phone, the information comes down from the top of the screen, and it's kind of like when you get a text or something like this.
Right.
And you can push it to go away, push up, and it'll go away. But you can set the tone you want for it to remind you. Yeah, absolutely. And also for Android, the same deal.
Oh, that's pretty cool. So I got to go back to how this all got started. So you started at Launchpad at the university. Is it Blackstone?
Yeah, Paul Gladen, Jen Stevens. I mean, they help entrepreneurs in a really big way.
And how did community get involved with you?
So through the Blackstone, I got a mentor, and his name is Jeff Petticord, and he's a marketing director. And I didn't know to go into hospitals. I thought maybe lifeguards, getting this into a lifeguard organization was going to be my hot key. But I needed to talk to somebody in marketing who knew how to market to lifeguards. Right. And so I talked to Jeff Petticord, who is a marketing guru for community
She's
medical.
got a fellow guru sitting right over there.
Yeah, and
a guruette. I'm sorry. Yeah.
He said, we don't just care about treating cancer, we care about preventing cancer too. And I was like, wow, community medical is cooler than I thought, because they're all about prevention.
You guys are way cool. Master says so.
Absolutely. And once we saw that there was common ground, that we both had the same mission to reduce skin cancer in our whole community and even on a global scale, then we realized that we could put an advertisement inside SolarScreen for community medical, so that the people who are using the app could get a hold of community, their 24-hour nurse on call. Let's say your kid got a real bad sunburn, or if you just broke your arm, like your daughter did just this last.
The injury also involves sunscreen, by the way. She put sunscreen on her hands before going on the monkey bars.
And oh boy, bummer.
Yes, but then you would just push the button and be connected with one touch to Community Medical's nurse on call, and they could tell you whether or not that fall warranted coming on in. And I think the relationship with community is a good way to get this to all the patients and other people like me who have had their kids at community and use Community Medical as their community hub.
So has your app, because it's on Apple devices and Android devices, so people all over the world could access the app, right?
Yeah, absolutely.
So have you noticed that happening?
Yes, I have. And it's very exciting to see people giving me feedback that they're reducing their their children's chance of having skin cancer, and that their children aren't getting sunburned like they did last summer and the year before because they're taking precautions because they know to. Now, they just didn't know that that was a thing.
They tell you, we're up against the break. When we come back, I want to ask you this question. I don't want you to come across like you're a killjoy. Like, it's summer, everybody's got to stay inside all the time. So we want to just dispel that, okay?
Absolutely.
Because, like you say, there's different levels of exposure to the sun. And you got to have some. That's vitamin D out there, right? So
have it.
We're going to be right back. I'm trying. I'm trying to make it happen here. 721-1290 is our number. 1-800-568-5309. Okay. Talking with Ryan Duarte, who's an inventor, has come up with a fabulous software app for your smartphone and to help keep the kids and yourself safe from getting skin cancer. So. Oh, I'm sorry. Go ahead.
I was going to say, by the way, the app is called SolarScreen. We just had a caller wanting to know how to download it. Or sorry, SolarScreen, and it's all together one word. When I searched for it, I had a hard time because I put a space in it. But if you put SolarScreen all together as one word, it's the first result.
Okay, so now let's talk about exposure to sun just in normal levels. It's not a bad thing, right?
No, it's a great thing. And right now it's a low UV index. And so I would say it's a good thing for everybody to be out there, do your walking, do your jogging, everything when it's a low UV index. But when the index exceeds your threshold that you set for yourself, then maybe just change behavior at that point. And then when it goes back under, you get another alert telling you you're back in the safe zone.
Oh, that's cool.
Yeah,
Okay.
and then you could go back out and enjoy the rest of that sun that you need for that vitamin D.
Okay.
Well, and you could still be outside enjoying the sun as long as you got sunscreen.
Right.
Absolutely.
Right.
All right. Now, do young people, do kids get skin cancer, or is it just a cumulative amount as when you're an adult? All that stuff you got as a kid kind of comes back to bite you?
No, as kids get skin cancer, and people who, if they expect to make it to 65, whether they're Mexican or black or white or whatever their ethnicity, half of the people who make it to 65 in their life are going to have skin cancer.
Wow.
And so it's a pretty big deal, and kids get it, and it's mostly from sun exposure. So if you can keep your kids from getting sunburned, that's going to really decrease their chance of having a
Okay, let's get John on the line. We're running out of time. We have about a minute and a half. John, go ahead quickly.
Hi.
What's on your mind?
I've heard that some sunscreen causes or can contribute to cancer because of the chemicals found in it. I've used it because I have super white skin and I burn. In fact, I burned this weekend, but luckily I started to get smart and got out of the sun because I know that I burn. Is there something called stupid screen?
Actually, this probably would qualify as stupid screen.
well.
Thanks for the call, John.
John, as long as you are keeping an eye on your phone and you see if you have a text message or you see if you have a message from SolarScreen letting you know you're in the danger zone, then you can change behavior, put on that sunscreen only when it makes sense. And I don't think there is a stupid screen for you, but there's a solar screen that's going to keep you and your kids safe from here on out. And this weekend it was a 10 on a scale from 1 to 11.
Wow.
Very, very intense sun. There was also an 8 and a 9 the days leading up to that 10. And a lot of people didn't realize how intense the sun was.
I do remember in a previous visit with somebody from community, we talked a little bit about this and the fact that be very careful which sunscreens you do some research and find out, which is more efficacious and which is more effective.
Well, and if John is against sunscreen, he's not, but if John knows somebody who's against sunscreen, then what you do is you just change behavior, meaning you don't have to put on the sunscreen. When it gets up past your threshold, go in the house.
Right.
Or put on the long sleeve shirt, the hat, do whatever you believe is going to help you not get skin cancer or sunburn.
We are running rapidly out of time. Give us some information. First of all, how do we get the app?
SolarScreen, all one word, SolarScreen, in your Google Play Store or your or on iOS. And you can also go to SolarScreen.co, and we have a video there and some more information for you.
Excellent. Ryan, it's a pleasure. Thank you.
Oh, you're welcome.
Good
Thank
to
you
see
very
you.
much for
All right.
having me.
Thank you. Thanks, Robin. Always great guests. This is great. This is Health Talk, folks, what it's all about. So we're going to come right back, and we have Rob Nadelson on the line with us in the next hour. He has some very important information to pass along, so stay with us.